Okay, so today we go to Moxibustion. And during Moxibustion, we do something preventing, like advanced events happens. So still on the safety aspect, still on the safety aspect. So that's for especially for today. For Chinese, we're talking about 针灸. That's for Chinese, we always put it together. In here, look like we just translate for acupuncture. Basically, acupuncture, just needles, didn't truly including Moxibustion part, and the jiu is Moxibustion. So that means in Chinese, we always put the zhen and the jiu together. Means Moxibustion is very important for the TCM practice. So that's generally say. So now we're talking about especially jiu Moxibustion. So Moxibustions, basically, we burning the herbs. Put on the different part of the bodies. And then the burning herbs generate some heat and also have herbs function there. So Moxibustion, we separate two big parts. One part we call directly Moxibustion. Another part we call indirectly Moxibustion. Directly Moxibustion, put moxa directly on the bodies. Indirectly, put moxa, put something between the bodies and the moxas. We have a lot of form like a moxa bar. And we can put the moxa over the needles. We can call warming needles. Sometimes we put salt between there, or maybe we can put other material between the moxa and the bodies. You will have a class especially tell you how to do moxa. So we are not talking about how to do moxa here. Our class mainly talking about how to safety, but give you some idea like how to do moxa by the radio. So we say moxa, including two big ways. First way is directly moxa, just like the radio. Put the moxa directly on the skin. Another way is indirectly moxa. Indirectly moxa we're talking about later. Now we're mainly talking about directly moxa. Directly moxa, we still have two ways to do it. One is scar moxa. What means scar moxa? Like overburning it, put a scar tissue on the skin later. This way is more traditional way. Right now, we are not that commonly used. Mostly, right now, we use no scar moxa. No scar moxa, just like a radio show us. It's more commonly used way right now. No scar. So that's basically we do no scar moxa. We try to preventing burning the patient. So that's if we burning the patient, truly later on maybe cause the scar later. But now we are not that commonly use scar moxa. So that's truly try not make the moxa cause the burning. So like the radio show us, yeah, we can use small moxa cone and then ask the patients, yeah, if too hard, we just stop there. Not over burning it, yeah, not over burning it. So that's we say the first things we do moxa, do not burning the patient. This especially, yes, especially we put directly moxa away from local nervous area and away from bigger artery area or blood vessel area. Yeah, away from artery, away from the vein, away from the local nervous area. And we stop burning when people feel heat. And also, we need to pay attention for some people. Special kind of people, they may more easily get burning, like diabetes kind of patients. Their blood circulation is very poor, and they may not truly feel the heat, but later on cause the burning. And also some other peoples, like after wind stroke, half part body people paralyzed. And the same time, they losing the feeling. Like normally, if we burning the moxa, people feel heat, and severe kind of heat cause painful situation. But that kind of patient, they couldn't feel it. Yeah, they couldn't feel it. So that means we couldn't only depending like a patient's feeling, then we stop like burning the moxa. We need watching it and stop burning before people feel it for that special kind of patients. But generally speaking, directly moxa, we try to not burning the patient. If we do no scar, no scar. If you try to do scar moxa, that's truly sometimes some TCM practitioners, they may still use, yeah, like a scar tissue formed in the local area, like a stomach 36 there. So generally say that's truly cause the burning locally, then locally got some inflammation there, and then healing. After healing, they form the scar tissue there. So that's like a pretty long time from the moxa to healing. So that's long time continually stimulation the local points there. So that's why some people like to do scar moxa. In this kind of case, in this kind of case, you must be tell the patient clearly what will be happens. And they sign the agreements for the scar moxa, especially because that's truly can cause the scar tissue later. So that's the first things we're talking about. Directly moxa, directly moxa. Directly moxa, we have no scar moxa, we have scar moxa. We need explanation to the patients, like a patient totally understanding what will be happens there. And the patient side agreements before we do this technique. Otherwise, like after we do moxa, and then you cause the local inflammation there, swollen there, patient may be sue you. That's for safety. Yeah, that's for safety. So explanation clearly to the patient and like they agree to do it. Then you do scar moxa. Yeah, then you do scar moxa. Even no scar moxa, you still need explanation to the patients. By accident, maybe some scar or inflammation may be formed, but we are not specially go to there. But by accident, still possible go to there. Still like patient for agreement for it. And then tell the patient what will be happens. So that's directly moxa. Yeah, directly moxa.
And teacher, I have a question here.
Yeah, go ahead.
So in the previous slide, you said diabetes and what kind of disease people, we need to be very careful about their feeling of heat. I didn't catch the other one.
Okay. So basically, yeah, some nervous system injured. You can put your hand there. Like you can ask a patient, do you feel my hand, the temperature there? So that's basically this afternoon. Physical examinations abilities, we are not go to there yet. When we go to nervous systems, we're talking about the patient's feeling. Patient's feeling, they can feel the touching, they can feel the cold, they can feel heat. So like you can use a bottle of the hot water, another bottle cold water, put in their skin and ask their feeling. If they can normal feeling, that means their nervous systems reaction is normal. But if they couldn't identify whatever cold or heat in there, that means they have nervous systems injuries. So that's basically is the patient's feeling part, feelings part.
Okay, and this kind of patients, they need to tell us, or perhaps they don't tell us, oh, I have some, neural injury, or how could we know they have this problem?
Some patient may tell you, some patient may tell you, they say, I have some illness before. I couldn't feel heat or cold. Some patients, even themselves, they don't know. So basically, when you do moxa, if you put moxa there, you can ask patient, do you feel heat? Do you feel heat? And like you can compare with other patients. Like normally, that small kind of like moxa burning out, people will feel heat. But if some people still couldn't feel it and totally couldn't feel it, that kind of people will have some injuries in there. Yes,
Okay, so normally we should check before we do it.
that's true. That's true.
Okay, okay, thank you.
Yeah, you're welcome. Yeah, to see if we have more questions in directly moxa part. Directly moxa. Then we're talking about indirectly moxa. Indirectly moxa, we have different ways, but it's a pretty common way. We put moxa cone over the needles. This kind of technique, we are not directly put moxa on the skin. Generally say it's not directly burning the skin. But be careful. Yeah, be careful. Sometimes, like the moxa may be falling down, like the needles bending, and the moxa touching the skin. And sometimes maybe ashes falling down. So we need to make a protection in there. So sometimes, like you put the moxa over the needles here, you can use a piece of paper and cover the skin part. Just in case the ashes, yeah, just in case ashes. Ashes still very hard, yeah, very hard. Still possible burning the skin. So that's about indirectly moxa. Generally speaking, yeah, generally speaking, indirectly moxa is a little bit more safety way compared with directly moxa because they are not directly burning the skin, but still need to be careful. Yeah, still need to be careful. So we try to preventing the burning. Yeah, we try to preventing the burning. But sometimes still possible the burning happens. If the burning happens, how we can manage it? So if patient be burning, the more important things, we need prevention infections. So basically, if we got burning, yeah, burnings, and the small area, not that severe, yeah, first degree, yeah. Basically, the burning we separate 3 degrees by how deeper we burning the patients, how severe we burning the patients. First degree is the pretty slightly burning there, small area and the superficial area. Second degree certainly is more bigger area and more deeper. Third degree is very, very severe kind of situation. Basically, I would like to say, our Moxibustion will not cause like a third degree there. Yeah, that's like sometimes the people get burning like over most part of the body, or moxas just small area, but possible go to second degree, like a little bit deeper there. If pretty shallow, yeah, like just the blister in there and in the superficial of the bodies, like immediately go to cold water. Over burning area, yeah, don't go to the ice. Ice is too colder, yeah, ice is too colder. Like they blocking superficial so faster and the heat inside couldn't release. So we go to cold water, then like something happens, like even when we're cooking, yeah, sometimes we burning ourselves. So immediately go to cold water, running cold water, at least 5 minutes. Yeah, 5 to 15 minutes. Then like the heat go. Yeah, then like the heat go. Like if you with some burning when you're cooking, immediately go to cold water and keep 5 to 15 minutes there. You will not cause the severe damage later. If you are not immediately go to cold water, maybe next day you got big boost there and maybe severe kind of inflammation there if you're burning severe. And then we're talking about we can use some medicine type to protection there. And some burning creams, we still can be used, yeah, depending how severe kind of situations. But basically, we need sterilized protection in there. So preventing infections, that's more important part. And certainly, if burning very severe, we say if go to 2nd degree, yeah, big area and a little bit deeper there, and possible cause some infections later, like a local area, is not that clear. And the patient's situation, immunity systems is not strong. We're still talking about diabetes kind of patient. Their immunity systems is pretty weaker. And maybe some aging people, children, their immunity systems is not that strong yet. So in that kind of case, tell the patient, go to doctors, go to doctors. So that's sometimes burning may still cause severe kind of situations. So that means, we need to be careful for the patients. Yeah, be careful for the patients. That's one aspect. Yeah, one aspect. And also we need to be careful for ourselves. Sometimes burning happens for the practitioners, still possible happens. Like in the radio, they talking about warming needles. Yeah, warming needles we put in there. Clinically, generally say clinically, like skin here, needle here. I like the moxa here, totally burning out. Yeah, totally burning out. It's not generate too much heat. Yeah, but even they totally burning out, when you withdraw the needles, the needle here still hard. Yeah, still hard. You still need to be careful. Yeah, not directly touching the body part. Still possible cause the burning. And also the first video, we see the people use the fingers stop the burning. So sometimes if your moxa cone is too bigger, still possible burning yourself. So that's still be careful if you do directly moxa. You can make a small moxa cone. And if patients like feel too much heat there, you can remove it with the forceps instead of fingers. But if you are good can handle that kind of heat, you can like the radio, directly use the fingers. But be careful, don't burn yourself. So that's small burning, yeah, small burning, which is locally keep it pretty clear and go to cold water and got good protections there, should be okay. But severe kind of burning, go to doctors. So that's we're talking about the safety. Yeah, safety guideline to preventing. We're still preventing moxa burning. Yeah, we are not waiting it truly happens. We're still preventing it. So preventing it, the standards, the standards we must be followed. We have some ruler, we must be followed. Thus, we're talking about ask patients, like we talked about before, if they have some illness, relationship, like they hard to feel, like the heat or painful, reaction to the painful and the reaction to the heat, that kind of patients, we need to very be careful for that patient. So before patient coming, before we do moxa. So generally say, directly moxa. Yeah, generally say directly moxa. We must be after the patients if they have special kind of condition. They couldn't feel the heat properly. They couldn't feel the painful properly. These kind of patients, we much be careful. And second aspect is during moxa, whatever directly moxa or indirect moxa, we need to keep in the room. Don't put a moxa cone over the needles, then you go away. So sometimes needle falling down and the moxa falling down. Sometimes the arching falling down. Certainly directly moxa, you must be beside patient also. Yeah. So that's during moxa, we stay in the room. Yeah, stay in the room. And also we're talking about directly moxa. Directly moxa, not go to the face. And the other sensitive area, yeah, including scapular area, yeah, scapular area. And we're talking about not go to over the artery, not over the vein. So that's some sensitive area. So that's be careful, yeah, be careful. And then we're talking about indirect moxa, yeah, indirect moxa. So protections for the archings, yeah, for the archings. So that's we must be follow, yeah, we must be follow like a standard ruler here, yeah, standard ruler here. That's any kind of patient when we do the moxa. Yeah, go ahead.
I'm curious why the scapula area is sensitive to Moxibustion.
Like over the skin, we have hair. Yeah, scalp. Yeah. Oh, yeah, sorry, scalp. Okay, scalp is not scapular. It's not scapular. Yeah, scalp. Yeah, 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 scalp. Yeah. So that's we must be follow the ruler here. Then some stronger recommend, yeah, for safety. Yeah, stronger recommend for safety. So when we do moxa, we try to do the points one by one. That means we can focus on that area, do moxa. Do not try to do multiple moxas during the same time. We couldn't focus, like some accidents happens. We don't know how to deal with it and hard to deal with it. if multiple moxa do the same time. And also we need watching the skin. Like how much heat coming from the moxa. Certainly we need to ask a patient's feeling, but like we talked about before, some patients, their reactions maybe not like normal people. So same time we watching the skin, like redness in there, or maybe look like too hot in there. And also ask patients, yeah, not only ask patients. So that's try to find suitable heat, go to local area. So that's strongly recommend. Yeah, strongly recommend. So we're still talking about how safety to do moxa here. Then recommend. Yeah, then recommend. Recommend. So like in the treatment room, when we try to do moxa, prepare some water in there in case some overburning. Yeah, overburning. Yeah. And fire extinguish. Moxa, yeah, moxa. We're talking about the direct moxa and the indirect moxa. Indirect moxa, we have another kind of way to do indirect moxa, mox bar to burning, close to the poise. The indirect moxa, we use mox bar like this longer. And this mox bar, after we use it, yeah, after we use it, don't put water there. If you put water there, you stop the burning. But next time you are hard to burn, to like it burning again. We can reuse it certainly, but don't put water there. So in the video, they put a pretty good container there, jar there, and stop air going, they will stop burning. And also clinically, we have a special kind of container, just like this kind of way. And just put the moxa bar, go to there. Because no air can go in, they stop burning also. So we have different way to stop the burning. But be careful, yeah, be careful, like sometimes, like just small, pretty short there, you are not used anymore. You think about it stop burning already, you put it to the garbage. But truly inside maybe still burning, maybe cause the fire. That's why we need a fire extinguisher there. But we just stop, just pay attention, like each time after we use it, we wait it totally stop burning. Then we leave the room. Yeah, don't leaving that still burning there, and we leave the room. So that's basically for the safety way. We preventing, mainly we talking about here, preventing moxa burnings. We talking about especially preventing for the fire later. So that's basically for this part. Yeah, any questions in this part? Okay, so
I have a question, teacher.
yeah,
so
go ahead.
All the prevention we are talking here, discussing here, are from the clinic perspective. So if we do moxa at home for ourselves, so we don't need to do so many prevention, right?
You still need to be careful at your home. Still the same thing, right? Yeah, like we talking about, you still have water beside you. that's just in case. And also you do at your home, like you still like put 1 point each time, not multiple choice. You still need watching to skin. And that's we still need to follow.
Yes.
And certainly at your home, you are pretty clear, like your family members maybe not have special kind of condition, but if they have, you still need to follow. Yeah.
Yes, so most of them, yeah, we should follow. But
Yeah.
I have some confused about why not moxa on the face, because we have some good points there.
We're talking about the directly moxa in case scar tissue forms there.
Okay, just direct moxa.
Yeah. We're talking about direct.
Okay, got it.
Yeah.
Yeah, okay.
Avoid directly moxa on the face. It's
Oh.
not indirectly.
Okay,
Yeah.
got it. Thank you.
Yeah, you're welcome. Yeah. Indirectly is okay. Yeah, not directly. Including over the hair, indirectly is still okay. Like we talked about the 220 is pretty good points for moxa, but not directly there. You're burning the hair. So we're talking about the first issue for safety issue is moxa burning. Yeah, moxa burning. Then we're talking about the second issue. Yeah, second issue coming from moxa burning is infections. Burning itself, it damages tissue. But after burning, it's pretty easily cause the infections. That's another issue, possible caused by moxa. So certainly, we're talking about moxa burning most of the time coming from directly moxa. After burning, that's certainly cause infections, mostly still coming from directly moxa. So that's the second issue. Yeah, second issue. So when we're talking about if skin burning, if it's more than 1 centimeter there, that's pretty possible cause the infections later. So that's we need very pay attention. Yeah. Small burning, less than 1 centimeter. We're talking about diameter here. Yeah, diameters about 1 centimeter. Like big toe, big fingers, some nails, kind of not bigger. Yeah, not 1 centimeter. So that's way be careful. It's pretty easily cause the infections. So we're still talking about how we try to preventing it. We're still talking about some standards preventing way. Yes, some standard preventing way. Preventing infections, firstly, we need preventing moxa burning. No burning, no infections. Infections happens after burning. So that's basically still the same way we try to preventing burning the patients. We always ask patients feeling, yeah, if you feel too hot or maybe feel painful there, yeah. When burning happens, firstly is some more heat there, and then it's kind of painful there. And we couldn't only depending patient's reactions. we also watching the skin, like two redness there. We talking about some patients, they couldn't totally reaction to the heat or response to the heat, to painful kind of situations. So that's we say we also watching locally for skin area. And we say we prevent second degree of the burning. That's basically is let to be severe. It's not just like a superficial skin, just one blister in there. Basically, they may cause some ulcers. So that's more severe kind of burning, more easily cause the infections. Our skin is the protection of our bodies. So that's basically we need to follow. And also we need to follow the safety guiding line for hand sanitizer. Like we talked about before. Before the treatment, we wash your hand. And after treatment, we wash your hand. But especially these kind of patients is burning. We need especially keep our hand sanitizers. So that's these kind of patients, burning kind of patient, their skin is damaged. They are more easily got infections locally. And we're talking about if burning just happens, we use the cooling running water immediately. So in this way, we're preventing the heat penetrated, go to deeper part of the tissue. They can relieve from superficial. So if it burning, directly go to running water, cold running water immediately. Don't go to the ice. Yeah, don't go to the ice. The same situations. Like some people go to outside, like the temperature is pretty low, like minus 30, 40, and some patients, yeah, some people, they feather their feet. When they go to inside the room, don't go to hot water immediately. If you go to like hot water immediately, truly it's caused like diced tissues on the feet. So same situation, yeah, same situation. In this kind of case, we still need to start from cold water, yeah, cold water. And if we're burning it, don't use ice, go to cold running water, like some temperature regulating in there, like gradually relieves. Don't immediately go to the ice. So that's the basically ruler. Yeah, basically ruler here. Then we talking about the stronger recommend. Stronger recommend. We need measures like how big it is, diameter, and the location of the burning, if it happens. Yeah, if it happens after moxa. We even can make a chart, like a draw pictures there, and like that's the arm area. That's people the hand here. And if we especially burning here, we can drag a picture located here and put a mark beside it. Yeah, 1 centimeter. So that's people immediately to see it. If you are not draw the picture, you can say 1 centimeter is burning on the right side, front arm. So people still know it. Yeah, people still know it. But if you draw pictures, it's more clear. And we watch it. Yeah, we watch it. So next time patient coming, we watch it. It's getting better and better. Should be fine. It's getting worse and worse. Maybe need to go to family doctors to get preventing some infections. So that's strongly recommend. Then recommend. Yeah, then recommend. So basically, we're talking about to see how severe of the burning and how many time, how many places they're burning. If they pretty severe degree and a big area, go to family doctors. So that's basically from the burning. Yeah, from the burning, they may cause the infections. So that's we need to be careful. Yeah, we need to be careful. Yeah, any question in this part? So that's usually happens in directly moxa. Yeah, usually happens directly moxa, but indirectly moxa still possible. Yeah, still possible. But the more dangerous part is directly moxa. And directly moxa burning the skin is the first issue. Skin burning. Yeah, skin burning. Second issue is infections. Follow the burning. Yeah, follow the burning. Second issue is infection. So keep in mind that's from the moxa, with possible burning the patients. And that kind of burning possible cause the infection later. Then we're talking about some others. Yeah, some others advanced reactions to moxas. So basically, moxa, they will generate some smoke. Some people may be sensitive to that kind of smoke. Like people usually have arthritis, asthma kind of condition. Yeah. People usually have asthma kind of condition. They couldn't handle that kind of smoke. And some people may be so sensitive to the smoke. So that's possible cause people kind of nausea. And that's possible happens both on patient side or maybe on practitioner side. So that's for inhaling the moxa smoke. So that's we also need thinking about. So preventing, yeah, preventing ventilations. That's the mainly things. Don't like too much smoke, like in the room, especially treatment room. Certainly, we're talking about ventilations in all the clinic. But truly, we mainly do the moxa in the treatment room. So mainly, the ventilations must be pretty good in the treatment room. So that's the moxa possible health smoke. So we have right now, like we have two different kind of moxa bar. We have smoke one. We have no smoke one. So traditionally, we only use the smoke one. But the issue or problem is, like we talked about before, if you try to look in the place to rent for your acupuncture clinic, lot of place they couldn't allow you to do moxa, no smoke. And maybe some complaint from your neighbors. They don't understand the TCM. They just think about that kind of smoke. Look like a cigarette. Yeah, look like a cigarette. Don't allow smoke in the rooms. So that's some trouble there. Now we have another kind of moxa bar. It's not smoke kind of moxa bar. It's dark color. Yeah, it's kind of dark color. It's less smoke. Yeah, it's less. I couldn't say totally no smoke, but much, much less. That kind of moxa bar you can use in your clinic if they don't allow you make a smoke moxa there. But this kind of no smoke, only moxa bar. They don't have loose moxa. We talk about losing moxa, the difference with bar moxa. Inside pretty same, yeah, pretty same. But the bar moxa is a little bit more expensive compared with loose moxa. You can open the bar moxa instead of loose moxa, but it's more expensive. And the bar moxa sometimes it's not that like smoothly like a loose moxa. So if you try to like a direct moxa, you can directly buy loose moxa instead of buy bar moxa, then you open it. Yeah.
Dr. Zhou, may I have the question?
Yeah, go ahead.
Yeah, I have never had experience for the no smoking moxa. Does that still have the strong smell? If some building is not allowed you use the moxa, you use the no smoking moxa?
Yeah, you can try use smokeless moxa. Yes, you can try. Yeah, but still let it be like a smell in there. It's not that strong, but still let it be smell in there. You still try open the window, like the air go to outside. It should be okay. Yeah, should be okay. Like each time you just use one, not multiple moxa there. Yeah, should be okay.
Got it. Thank you.
Yeah, you're welcome. So that's about the smoke of moxa part. I think that's repeated the page here. So that's the moxa part. Yeah, that's the moxa part. Then we're talking about other heat therapy. Yeah, other heat therapy. Other heat therapy, mostly clinical we use is kind of heat lamp. This kind of heat lamp. Let's go to some pictures for TTP lamp. Oh no. That's not right. Okay, here we are. Okay, we have a lot of different kind of form heat lamp. Yeah, maybe some small one, maybe some bigger one. Some heat lamp have two height, mostly just one height. But whatever, it can generate heat. Yeah, generate heat. So you can see we have a lot of different kind of form here. Small one, bigger one, standing one, and on the desk one. So that's basically it generates some heat, go to locally of the patient. Yeah, locally of the patient. So you can see we have so many here, so many here. So this heat lamp, yeah, this heat lamp, certainly we can use for warming for the patient. And also these kind of heat generating can treat for the patient, like locally moving qi, moving blood, and can relieve some painful situations. So that's for TTP lamp, yeah, TTP lamp clinically used. So basically, when we use TTP lamp, we still like adjustment for the lamp of the arm. Yeah. So not too close. Yeah, not too close. These kind of TTP lamp, they getting warm gradually. So basically, take about 10 minutes. Then they can get out like the heat you expected. Before 10 minutes, they still get heat, but gradually. So that means when you just put close to the patient, patient may tell you, oh, not warm, yeah, not warm. You need to watch it like, especially first 10 minutes, in case not too close to the patient, because the heat generating gradually. So that's if you are not monitored, maybe still possible burning the patient. So that means you put like a TTP lamp there, and then you go to outside, and the heat lamp go to very hot, and the patient yell to you. You couldn't hear it sometimes if you're too far away. So that may be burning the patient. And also we talking about some patient not that sensitive, like to the heat. They may don't know it's overheat there. Then maybe cause the burning. So basically, most heat lamp, the temperature is not adjustable. You just adjust it with a little bit more close to the patient, or little bit away from the patient. So that's on TTP lamp, you can see here. So this part you can adjust it. Yeah, this part you can adjust it. You can put like this angle here more close to patient, or maybe you can make the angle like this away from the patients. But the TTP lamp itself, they don't have temperature adjustment. So that means you need more watching for the patient and then adjustment, like how far away. So that's monitored, monitored, especially the first 10 minutes you monitored and adjustment to there. So if too close, still possible burning the patient. And another issue, we say we can adjustment from the arm of the lamp part, but it possible some lamp, they slowly moving down itself. Like if you finish adjustment in there and then you left, like originally, like this hair, the patient in here is pretty safety, but gradually they go down, go here. So that means they're more close to the patient's skin. So you're always coming back to check. Yeah, always coming back to check. Yeah, not after 10 minutes, you are not checking. If you are not checking, still possible, they moving down itself and get more heat, burning the patient. So that's about TTP lamp. And we're still talking about the prevention way, how we can do it to prevention that kind of heat lamp burning there. So the ruler, basic ruler for this one, don't use in the children. Yeah, don't use in the children. Children's skin is pretty thinner, pretty easily damaged. So try not use for the children. We didn't especially talking about for directly moxa before. For my opinion, still not directly moxa for the children. Indirect moxa is okay, but still need watching. Yeah, still need watching. So that's for the children. And also, don't use when people sleep. When people sleep, they couldn't feel. They don't know too hot or too not hot yet. So that's pretty easily cause the burning. If people sleep, then we put a TTP lamp there, and they no reactions, and pretty easily burning. And certainly people unconsciousness, same idea. They don't have reactions to the TTP lamp. And also TTP lamp use electrical. Any kind of electrical machine, we need preventing for water. Yeah, don't put water to it. And also sometimes, even some too moist thing still cause the electrical machine cause some trouble. So that kind of trouble is electrical trouble. Yeah, it's not heat trouble. So that's keep the dry, not too wet or moisture around the equipment, TTP lamp there. Yeah, keep environment is dry in there. That's a safety way to the electrical kind of instrument, electrical kind of machine. Yeah. And before we use it, we checking the TTP lab. It's not damaged, no creak there. So that's if some creaks there, maybe cause some trouble. Yeah, maybe cause some trouble. And don't like it touching other equipment, superficial area. So separate. So we say TTP lamp generate some heat. If we're too close to the patient, they will cause the burning for the patient. If we're too close to some other superficial area, especially some like the wood, the paper, is pretty easily burning. That will be dangerous, especially for our TCM clinic, especially away from alcohol. So that kind of heat maybe cause the fire. So that's the way we safety use TTP lamp. We're still talking about some patients. There are slow reactions to the heat or no reaction to the heat. We need to very be careful, monitor, watching the skin, and then like if too redness there, moving away. So same idea like a Moxibustion, but the TTP lamp use the electrical. We also need more pay attention for it. Then we're talking about the strongly recommend. Yes, strongly recommend. So try not too close to the material we use for Moxibustion. Like we talking about like alcohol, like some paper or whatever. That easily cause the burning, yeah, cause the fire. And also we're talking about the patient, yeah, special kind of patient, still the same idea we talked about before. Like a patient have diabetes, and the patient have nervous system disorder. The reaction to the heat is slow or totally no reactions. And the reaction to the painful situation, too slow. That kind of patient will be careful to use it. Yeah. Still not only by patient tell you, still ask a patient. Yeah. Yeah, still ask a patient same time and watching for the patient, watching skin reaction in there. If too much heat there, the skin must be very, very red there. Then we're moving it away. And sensitive area of the skin. Sensitive area of the skin, I still like to say like some face area, people may be more sensitive. Now to use, yeah, now to use. And also patient have blood circulations disorder. That's still same idea. They couldn't feel it. Yeah, they couldn't feel it. So we be careful to use it. And we always monitor the skin temperature and the color there, like by the heat there. And not only by patient tell you. Yeah, patient, some patients, they are not truly can tell you, but maybe still cause the burning. So that's the TTP lamp part.